Good evening and welcome to our COVID-19 special program. I'm Neota Igwe, and here are our highlights for this hour. Businesses opening Kaduna State following the easing of the lockdown measures there. Nigeria Center for Disease Control accredits 180 testing capacity labs in Jigawa State. And World Health Organization says there is little evidence that changes in season will affect the spread of COVID-19. After almost 3 months, businesses are now opening Kaduna State following the easing of the lockdown by the state government. Governor Nasir El-Rufai had on the 26th of March announced an indefinite lockdown all over the state as part of measures to contain the spread of the virus. However, after 75 days, the government says businesses can now open under some safety conditions which must be adhered to.
Kaduna is the first state in the country to impose an indefinite curfew as a result of the outbreak of coronavirus. 75 days after, the Kaduna state government announced the easing of the lockdown.
Subject to compliance with safe reopening protocols, the following measures will be in place in the first instance until the 30th of June 2020, subject to amendment, extension, or renewal as considered necessary. Number 1, restriction of intra-state movement is lifted subject to a nighttime curfew of 8 p.m. to 5 a.m. Number 2, businesses can reopen subject to the provision of thermometers for temperature checks, sanitizers or hand washing equipment, and physical distancing measures within all facilities. Working hours will be from 9 a.m. in the morning to 3 p.m. in the afternoon. 3, church services are allowed only on Sundays, and mosques are allowed to conduct only Friday Jumu'at services for the time being, subject to compliance with the safety stipulations above.
The relaxation of the lockdown brings the city of Kaduna back to life. Residents are excited over the easing of the lockdown, and many have already opened their businesses, praying and wishing never to experience such a situation again. For traders whose shops are located inside the market and students, they will have to wait for more time as government says those markets and schools are to remain closed owing to their vulnerability to infections.
They said we shouldn't open. Even one policeman came that we shouldn't open. I was even surprised that why won't we, I asked him that why won't we open? He said, the governor said we shouldn't open. So we had to start closing our shop back.
As Kaduna reopens for business, the possibility of maintaining physical distancing is one issue that many residents are still not taking into consideration. The state governor in his broadcast reminded residents that staying safe against coronavirus is now in their hands. No dates have been set for the reopening of markets and schools, although the government is still working out its planned stages for full lifting of the lockdown.
And while the business owners and some residents of Kaduna State are rejoicing that they've been able to get back to work, one person has been confirmed dead as a result of complications from the deadly coronavirus in Imo State. This is the first COVID-19 death recorded there. Addressing newsmen in Owerri, the Imo State capital, the chairman of the COVID-19 task force, Professor Maurice Iwu, disclosed that the person had underlying health issues before he was brought in, which might have complicated his situation. There are about 19 surviving the disease. Our correspondent, Tokwe Kute, has more update from that part of the country. Tokwe.
Good evening. Imo State has recorded its first COVID-19 related death. This was confirmed by the chairman of the COVID-19 task force in Imo State, Professor Maurice Iwu, while briefing journalists earlier today in Owerri, the Imo State capital. The deceased was reported to have a serious underlying health issues.
The active cases we have now are 12, 6 at the FMC, 6 at the Woody Center. We have 2 females and 3 females and 9 males. contact tracing of these people are still going on. But on Saturday, there was a case that was a probable case, somebody who died and then was tested after death to find out what he died of was of coronavirus. So one can say categorically that there was a death case that was attributable to coronavirus.
With 86 confirmed cases of the coronavirus disease, the task force says contact tracing is on top gear, while the government is still appealing to indigents to continue to adhere strictly to the precautionary measures put in place by the government to contain the spread of the virus in the state. From Owerri, the Imo State capital, Eyitokwe Kuteyi, for COVID-19 updates.
And as healthcare workers continue to man the front lines of the fight against the coronavirus pandemic, there is need for adequate insurance cover so that those who lay down their lives for others will not have done so in vain. The chairman of the Nigerian Medical Association, Edo State Chapter, Dr. Valentine Omoifo, made this call in an interview in Benin City, the Edo State capital. He asked the government to include healthcare workers outside of COVID-19 facilities in their compensation packages.
Mrs. Stella Esson arrives at her office for work. She's the chief nursing officer at the Ogbe Nursing Home, an 11-bed holding center for the testing and treatment of coronavirus. Inside the office, her mufti gives way to the official uniform as she settles down for duties. The simple protection of a face mask does not reflect the risks involved in handling the severity of patients expected at the center.
As a health worker, I'm not afraid because I know that there are some things there, there are equipments there that I will use.
Besides the passion for the job, healthcare workers should also be well motivated. The chairman of the Nigerian Medical Association Edo State Chapter, Dr. Valentine Omoifo, believes that the frontline workers against the virus need better attention.
We have health workers being exposed, some of them positive. A couple of them are dying in some other states. And now what happens to their families, after this period? No proper insurance package for them, no life cover. You just die and then your people are left, alone to bear the burden.
He adds that the benefit to health personnel should not be limited to those working in COVID-19 facilities.
So most of the people who are even getting infected today are not even those in isolation centers. There are health workers who man everyday clinics, everyday accident and emergency centers, seeing patients. And, it will surprise you that even when the federal government promised to pay enhanced hazard allowance to doctors, we admit with our state governor here, but they said only those in the isolation centers will benefit, from whatever they are giving. And we think this is unfair.
As of June 2020, the number of positive COVID-19 cases in Edo State stand at 429, with 24 deaths recorded, a worrisome statistics. But healthcare workers say they have a duty to save lives. What they expect from government is incentives.
Well, it all started with those with travel history to countries battling the COVID-19, then to contacts of index cases. And now 72% of confirmed COVID-19 cases in Nigeria are due to unknown exposure, that is, infection picked up within the community. Members of the Presidential Task Force on COVID-19 have repeatedly said that the country is not experiencing active community transmission of the virus. Recently, the Director General of the Nigeria Center for Disease Control, Dr. Chikwe Kwazu, announced that about 812 health care workers have contracted COVID-19. While the PTF has called on state governments to own the COVID-19 response, stemming the increasing number of infections amongst health workers is the key in the fight against this virus. But to talk to us more about this and how this can be achieved, I'm joined in the studio by a consultant public health physician and senior lecturer, College of Medicine, University of Lagos, Dr. Alera Roberts. Thank you for joining us.
Thank you very much for having me again.
So 112 cases.
812.
812.
812.
812.
Almost 1,000. 812 healthcare workers. A very precious resource.
These are the ones in the front who are supposed to be better protected, so to speak. But how is it so?
Good question. And I really do love my job. However, the truth of the matter is that we were inadequately protected right from the get-go. So a lot of the healthcare workers who are in the front line are those in federal medical centers, teaching hospitals, general hospitals, who have to see patients whether or not they are diagnosed with being as having COVID or not. Now, bear in mind that many people come to the hospital and they are ill, first and foremost. That they have been exposed to the virus and therefore carrying the virus may merely be a by-the-way episode. So they actually have an underlying illness that has brought them to hospital. They may be a known diabetic, they may be a known hypertensive, they may be pregnant. Yeah. And, you know, they've been exposed to the virus. We've got it all over the community. So everybody has to be presumed to be carrying the virus. And of course, if you now meet up with a healthcare worker who is a little overworked, overstretched, underpaid, these are the natural outcomes that you're going to get. And, you know, if we don't have the protective devices that we need, the personal protective equipment, the enough masks, enough gloves, enough sanitation equipment. And don't forget that, you see, there's a side of it that a lot of us don't take care of. It's not just the PPEs that are being donated. Thank you very much to all the donors who do donate PPE. But if we don't have running water, there's a huge problem. If we don't have toilets that flush, if we don't have the cleaners who are also adequately trained and protected to go ahead and do the cleaning, then you still have the hospitals being a petri dish, as it were, of infection.
I was going to say that besides the provision of the equipment, as the PPEs that we need, the running water and all of that, the question of mental preparation, how much of that has been given?
Not enough. Not enough. And I must confess, a lot of us are getting really tired, worn down, burnt out. Not enough.
Psychologically, okay, during one of the briefings we heard the PTF talk about the need to introduce psychological care for the health workers. Besides the call for some, like the NMA chairman in Edo State asking for health insurance for not just those in the testing facilities or isolation centers, even in the other health facilities across the state and indeed across the country, what kind of psychological care should be provided for the health workers?
I think one of the things that was very painful is that you keep hearing these rather ill thought of statements that, after all, it's a humanitarian job. It's, you know, why are they always asking for money? Well, it's not just that. You see, our children go to the same schools. We go to the same markets. We have to buy the same petrol. We have to live and pay the same landlords. And then we have to do all that and face this scourge, this pandemic, without any... What happens to us after, if anything were to happen to us, what happens to our children, to our parents, to our siblings, to our dependents? Who is there to look after them? If I can't pay the rent or I can't pay the school fees, what's going to happen? And I need to worry about that and have a mind fixed on solving your health problems. These are things that we don't often think about. And this is what makes a lot of the healthcare workers feel at a point, this is a thankless job. What am I getting out of this? And these are questions that the government really does need to address and address very quickly.
But while we're waiting for the government to do that, is there anything that can be done? Because yes, the calls are going out, and even there's a threat of downing tools in a couple of days. What happens to those that need health services?
Well, there are private... The problem is the changing, how do I put it, the changing legislation, you know, that surrounds a lot of this. There are private initiatives that do want to do. I know there's a consortium of about 5 health insurance companies that have come together to put together a package, a health insurance package for healthcare workers. But it's still got to be regulated. And whether that is being done to the protection of healthcare workers and their families, who's going to make sure that the payout comes in case, yes, how soon will it come? You know, these are things that need to be looked at and things that healthcare workers need to be assured of before they would feel. And then to who does it go? You know, what's the extent of the coverage? Because in the health system, everybody is a healthcare worker, right from the gates to the medical director's office. Everybody who works in the health system is a healthcare worker because we cannot. And is yes. I mean, I was in the hospital today and I was so glad to see our engineer working on a certain section of the corridors. And I felt really, really grateful that he had come out to work and he was working so close to the isolation center. And one would say, oh, but he's an engineer. Yes, but he's a very vital member of the workforce. So we do need to pay a lot more attention to the psychological care, psychological well-being of our healthcare workers. And insurance is critical. Everybody must have it.
Well, this is, the call out is for everybody to be taken care of.
Yes.
Both those
in the health system.
Who are trained as health workers and those who are adding services in the health sector.
Absolutely. The health system is like the human body.
Thing.
It's a wholesome thing. Can you think of any part of your body that is not useful? Maybe your hair, maybe your fingernails. So we'll call that the refuse. Every other part of the human body is vital and needs to be in optimal working condition for the entire body to work optimally. And that's how the health system works. There's nobody who's more or less important than the other, because the doctors certainly cannot work if we don't have the nurses, the pharmacists, the physiotherapists, the ancillary workers. None of us can work without the health and safety engineers, without the environmental health officers. So it's one system, and it needs to be properly supported and strengthened.
Thank you very much. Thank you. Dr. Alero Roberts is a senior lecturer, a consultant public health physician, and a senior lecturer, College of Medicine, University of Lagos. Thank you.
Thank you for having me.
Thank you. And very quickly, we'll head out to Jigawa State, where there is a need to find out exactly what is going on. How are the people there? Our correspondent did go out there to find out what the situation is in Jigawa State, and we'll bring that to you right now.
We've been talking about establishing a molecular laboratory in Jigawa. The accreditation team from NCDC came and they've accredited the laboratory, so our laboratory is on and is currently running. And I've even seen the NCDC have released in one of their Twitter updates that Jigawa laboratory has been accredited. So henceforth now we'll not be sending any samples to Kano or any other place. We'll be carrying out our tests here.
That laboratory in Jigawa has 180 testing capacity. That means about 180 tests can be taking place in Jigawa State going forward after this accreditation by the NCDC. But in Borno State, there was reports of certain deaths that happened in Borno State. The governor did go out to see what the situation is, and our correspondent brings us that update now.
When the Borno State government called off the statewide lockdown, it was with conditions, and these conditions were nothing new, but the regular COVID-19 safety guidelines, namely wearing of face masks, imbibing the culture of hand washing, and maintaining physical distancing. Now, the outcry at that time was that of lack of access to wash materials and face masks, and a lot of people said they could not afford to buy face masks. But in the last few weeks, we have seen a lot of indigenous organizations and public-spirited individuals distributing free reusable face masks in thousands in public places. And also remember that there is a percentage of the population who can actually afford to buy face masks for themselves. So with this, it is safe to conclude that a large percentage of the population in Maiduguri have access to face masks.
At the level of the government, we are still taking measures as a matter of policy as part of COVID-19 prevention. Now, the engagement is still ongoing. Religious leaders are still talking to people. Political leaders are still talking to people. In fact, there are even extent that we go where we do it silently in ensuring that people who have access to markets are only allowed to go in when they have face masks. But you know the irony of it, there are some people that you see, they would wear the face masks before they enter, and as soon as you give them access, they remove it. What do you do with that kind of situation? You can only continue the advocacy.
But then what we see in the metropolitan every other day are people going about with their faces, bare without wearing face masks. You see them sitting in clusters. You see them in fully loaded tricycles, the major source of commercial transportation in the city. All, in flagrant disobedience to the safety guidelines given. The government is worried about this, and we understand that advocacy continues until everyone complies. From Maiduguri, I am Blessing Tuno Aso for COVID-19 updates.
Thank you very much, Blessing. We'll take a quick break. When we return, we're looking at what is going on the website of the NCDC. What are the numbers like? Look at all the breakdown in a moment. Just stay with me. Thank you for staying with us on our COVID-19 special program. Now, 13,464 are the total confirmed COVID-19 cases in Nigeria after recording its highest infection in a single day. That's about 663 yesterday at the Nigeria Center for Disease Control. With 4,206 discharged and death toll at 365, the new infections are recorded in 25 states and the FCT. Lagos has 170 cases, while neighboring Ogun displaces other states to record the second highest figure with 108. A breakdown by regions shows that Lagos in the southwest has a total of 6,065 cases, followed by Kano in the northwest now with 1,020. The FCT tops in the north central with 1,012 cases, while Edo leads in the south with 462 cases. Borno retains its 367 cases, while comes top in the northeast, while Ebonyi leads in the southeast with 152 cases. And talking about the southwest, our correspondent Bukola Orio brings us an update on what is going on in that area. Bukola.
The curfew from 8 p.m. to 5 a.m. is still very much at work in Oyo State, although we found out that after 8 p.m. we still have movements in certain places within the state. But that's not the major concern right now. The concern is the fact that the compliance to the use of face mask is nothing to write home about, because we've been to quite a number of places. We've been to marketplaces, we visited bus stops, we visited quite a number of public places, and we found out that very few people are actually complying with the use of face masks. Some of them they kept it in their bags for reasons best known to them. Some don't even bother to bring them. We find people tripping into the market without their face masks, coming to buy commodities. And we found some of the sellers, though some of them were using, but a lot of them are not using their face masks. That's one. Secondly, we found out that commercial motorcyclists and motorists are still carrying so many passengers, and none of them without protection. We found some motorcycles carrying as much as 3 passengers without any of them having any face masks on. And the ripple effect of this kind of action is what is actually scary. We spoke to the incident manager in Oyo State, Dr. Ladipo, on these issues of concern, and he did shed some light on it and made appeal to the people for compliance.
It's something of worry, it's something of concern. More so, we felt these are things that we need to put in place to ensure that people remain healthy. However, there had been some studies, the EOC had been part of a study that showed that there was low perception of risks in the communities, and that is something that gives us a lot of concern. We're trying to re-strategize on our risk communication to see how best we can ensure that people do understand the risk that is involved, not conforming with the advisories that have been given across by government. Their perception of risk is not well defined, and we need people to understand that the coronavirus is something that is very well transmissible.
Community testing, which began last week Wednesday, is still very much on, and efforts are still being intensified to make sure that the enlightenment increases so that more and more people would come out for this test. For COVID-19 updates, Bukola Oriowo, Channel Television News.
And from our studios in Abuja, I'm now being joined by a medical laboratory scientist who's also the National Publicity Secretary of the Association of Medical Lab Scientists of Nigeria, Dr. Kashmir Ifeanyi. Thank you for joining us, Dr. Ifeanyi.
Thank you, Anya.
Dr. Ifeanyi, let's start out with this matter of compliance by Nigerians to the guidelines of face masks and social distancing. From the reports we've seen so far, there seems to be a continuous decline of adherence to these guidelines. What do you think is the issue?
You see, the violation of the non-pharmaceutical intervention protocol is a cause for worry, particularly for those of us who fully understand the import of such flagrant disregard for those safety protocols, the non-pharmaceutical interventions. We're worried because, honestly, I think we have not communicated effectively to the populace. That is why I had said earlier on in some other fora that the way we eased lockdown is good. We want to rise together with other parts of the globe. However, we did not do sectorial-based risk communication. What you need to tell the person who is in the open market vending tomatoes certainly wouldn't be what you are going to tell a clerk or a grade level 14 officer who you had asked to be coming to work Monday to Wednesday, Friday before the further easing of the lockdown. So there's a major disconnect in the communication. If we want to succeed at getting enhanced compliance, we must resurrect the communication templates, the communication protocols that were adopted in the efforts against HIV/AIDS in Nigeria. That is what will work. We must disaggregate people according to their tiers of operation, sectorial, and use their own system. I had said, for example, in the transport sector, if you want it to succeed, then what do you need to do? Engage the leadership of the National Union of Road Transport Workers. Train them as train the trainer. They will be able to cascade your instruction and get you the compliance you desire. Same thing goes for the Market Women Association. We opened markets. We didn't engage the leadership. All these sectors have their leadership. They have a way of enforcing compliance to regulations that they make for themselves or which government want them to conform to. That has not been done. In all the cities, call it Lagos, Abuja, Kano, across the 36 states of the country, the violation, look at how people mass themselves together. Now look at the governor of Lagos State and all the entourage with him fully complying with the non-pharmaceutical intervention. But visit the market, visit the bus stop, visit the malls that are beginning to open. You will find out people thinking that life has returned to normal. Honestly, life is yet to return to normal. The COVID-19 virus, the pandemic is still here with us, and it is a lot more ravaging. Look at the numbers as they are going up.
Dr. Ifeanyi, while we're concerned about the people who are non-health workers and the way they are flagrantly disregarding the non-pharmaceutical guidelines, as you put them, what happens to the health workers who, some of them are sort of like downing that guard they had put up against this matter with the use of face masks and gloves and sanitizers? How are they carrying on?
Yeah, you see, from the last report, we had well over 800 healthcare professionals or healthcare providers test positive to COVID-19 in Nigeria. The major reason is this. Honestly, the fact that when this emergency came, we had to resort to makeshift provisions for purposes of isolation, for purposes of treatment. You can recall and connect correctly that even stadia were converted to isolation and treatment center. Now, you find out that when you want to talk about safety or protection of the health worker, one thing that is fundamental in quality management system is facility and safety. Now, facility and safety have two components, the primary component and the secondary component. It is the primary component that deals with issues of personal protective equipment. The secondary component deals, or what we call the secondary barrier, deals with issues of design, ergonomics. If you turn a stadia to an isolation center, you would have, of course, you will have no ergonomics, no design, no considerations for secondary barrier in place. Now, that's one of the problems. Another one is that before now, honestly, the average health worker is ill-trained on the use of personal protective equipment. And so there's a gap, training gap had existed before now. People were used to seeing patients unguarded, and that is not a standard practice. That is not best practice. That is a non-conformity. It is that non-conformity that is extending to what is happening now. Now, if you disaggregate the number, just yesterday, we buried a medical laboratory scientist who died of COVID in Kaduna State. Today again, a medical laboratory scientist died on road traffic accident en route Abuja with specimen he was ferrying into Abuja, COVID specimen. So a lot of healthcare professionals are going down as a result of exposure and ill treatment. So what we need to do is a continuous training and retraining of healthcare professionals on the donning, doffing, and the deacons in the use of personal protective equipment. Again, we must develop protocol or templates for action or activity-based personal protective equipment and train healthcare providers on that. That is not being done. It's a major challenge. What we require to go pick up a patient with an ambulance is not what we require to do a triage at the entry of the hospital. You find out that most of our hospitals are still operating as they used to. Because of this pandemic, we're supposed to have instituted a triage point almost at the gate of our health facilities. And the persons that will man these triage points at the entrance of the hospitals would have been properly kitted with the appropriate PPE to deal with that. So that's
okay,
not
Dr.
happening.
Dr. Fine, if I may come in here,
you've
mentioned training a couple of times in your your last submission here, that you're talking about the need for training, especially in the use, the putting on and the putting off of the PPEs. When do you expect this training to have happened? It should have happened before. Do you expect it to happen now? How would that be? How would that work? And how should it be? Is it too late?
During the war, in military parlance and in paramilitary parlance, there's what we call parade. That parade is a form of training. It's a form of evaluating compliance to rules. That is not happening periodically. That needs to happen regularly in the course of this engagement in the COVID-19 pandemic efforts. There has to be a regular parade if it's in the military. Now it's in the health sector. There has to be clinical reviews. There has to be compliance evaluation. If that is not being done, you find out that compliance rates will not be very strict and not be top-notch, and people will become vulnerable. For every health worker that gets infected, you must look at those arising as a result of compromise in the use of personal protective equipment or inadequacies in the supply of personal protective equipment. You will find out that all through this pandemic, particularly at this later point when donations came, it became almost the duty of the NCDC and the PTF COVID to distribute this PPE. And I must tell you, globally, there's a short supply of personal protective equipment. And so the truth is that it is being rationed. And even when it is rationed, are they made available to the healthcare workers as they should?
Dr. Fine,
this case in the Southwest.
Dr. Fine, just before we let you go, just before we let you go, the matter of the laboratory scientists here, how the level of exposure they have beyond just the isolation centers where they work and the testing facilities, there are other health centers that also have laboratory scientists there. How best can they operate to ensure that they carry on their task, they are protected, and services still rendered?
Thank you very much. One thing that will help you have a good medical laboratory practice is quality management system, laboratory quality management system. We have, over time, in the last couple of years, trained our members, and the training is a continuous one. It's a continuous professional development program on the laboratory quality management system. That's in practice already in very many health institutions. Unfortunately, most tertiary health institutions in Nigeria, teaching hospitals and federal medical centers, have not given the management buy-in in the institutionalization of quality management system. It's a major worry for us. You showed the laboratory, I saw the laboratory person playing with tubes, and that person is doing it outside the biosafety cabinet. And I just do hope that, I do not know the level of manipulation he's doing there, but those are PCR tubes, meaning it's a molecular manipulation and shouldn't just be done in anywhere. Most laboratories in Nigeria are not purpose-built. The part flow of work is not in strict compliance with ISO standards for part flow of work. It's a major concern for us. You get into a laboratory, it has only one entry. Any laboratory with one entry and no exit way, at times like this, when you are dealing with high-fatality diseases, you are supposed to have the route you enter should be different from the route you exit. Those are not in practice in Nigeria.
We really have to go, but I will ask you this. In 10 seconds, what should be done about those things you just mentioned now? In 10 seconds, please.
There has to be a holistic intervention from government to renovate these facilities. And in doing so, drawing the plan, you must carry the medical laboratory experts along. Like the PTF COVID, as I speak to you, there is no medical laboratory scientist working with them. There's no medical laboratory expert in the technical aspect support group
Dr. Kashmir,
of the PTF that is the major problem.
Dr. Ifeanyi, thank you very much. Dr. Ifeanyi is the Publicity Secretary, the Publicity Secretary of the Association of Medical Lab Scientists of Nigeria. He's a professional in that field, and that's why he's so passionate about what he's talking about. But let's go quickly to Bauchi, where our correspondent Hajara Aliyu brings us an update on the situation there. Hajara.
Deputy Governor of Bauchi State has recovered from COVID-19 after 9 days of isolation. And on a sad note, the state has lost a prominent medical doctor, Bello Katagum, to COVID-19. So far, 51 health workers have tested positive for COVID-19 in Bauchi State, spread across 5 local government areas, with the majority of the cases in Bauchi, the state capital, and Azari, Katagum local government area. Only one journalist has tested positive for COVID-19 in the state, and he has also recovered.
Out of the 51 medical personnel in Bauchi State that got infected during their duty, only one of the medical personnel died, and he's a senior colleague. And then we also have 2 more medical personnel that are infected in the course of their duty. So there's a lot of risk, we that are working in the health sector. And the Bauchi State government, in its wisdom, has paid all allowances amounting to 15 million just 3 days ago to all the healthcare workers working in Bauchi State.
In the meantime, there are growing concerns over the fate of inmates who just tested positive for COVID-19 in the state, while the Task Force Committee cites security and legal concerns as conditions for admitting these inmates into the isolation centers, because any of them could escape at any time. The Correctional Service Authority says talks are still ongoing with the Task Force Committee to determine the next line of action, even though a solution has been created in the interim.
And a new cell for them has been created for their treatment and management by officials of the Bauchi State Task Force Committee on COVID-19. This is coming on the heels of, the refusal, let me put it that way, the refusal of the State Task Force to evacuate the inmates, the affected inmates, from the custodial center to the state COVID-19 isolation center in Bayara. So we felt there's nothing we can do other than to keep them at the custodial center separately, and the official will be coming for their treatment.
It is important to note here that the inmates who tested positive for the virus were newly admitted into the correctional service last Friday, and they were kept in the holding room away from other inmates before they tested positive for the virus. From Bauchi State, Hajara Aliyu for COVID-19 updates.
Thank you, Hajara. Now, the first case of COVID-19 was recorded in Germany towards the end of January near Munich in Bavaria. Since then, over 187,000 cases have been confirmed in that country. What's the COVID-19 situation there? Joining us from Hessen in Germany is a senior consultant in internal medicine, Dr. Zainaba Adamu. Thank you for joining us.
Hello, thank you for having me.
Yeah, so what's the situation in Germany at the moment?
Well, I could say things have eased up a lot. We were, as most of us know, in lockdown for almost about 8 weeks. And presently, it's kind of like really, the cases have gone down and it's really low at the moment. And we're kind of like much more free to say. But things are getting better, definitely.
But when you say things are getting better, let's look at the health facilities. How is the infection prevention procedure carried on within the health facilities to protect the health workers there?
Well, that's a good question. At the beginning of the pandemic, when everything started, hospitals were restructured completely. It was really, hospitals were restructured in such a form that you had the opportunity to isolate patients. And I think it's important to know that the medical personnel actually got training. As soon as we found out the first case was in Germany, training started for all of us, for doctors, for nurses, for cleaners, on how to go about it and how to actually protect themselves. I also think it's very important the fact that the government actually provided, there was really availability of protective equipment for every personnel, mask and actually whole body protection. And we were actually trained in the beginning how to put them on properly and how to actually take them off us. And that's quite important because in doing so, you prevent yourself from coming in contact with the virus. Communication with patients from a distance, we had to keep a distance of almost 1.5 meters while communicating with patients. Of course, in cases of emergency, that was different, but then you could actually take care of the patient, even reanimate the patient, but then you'd be protected while doing so. And
yeah, go ahead.
I beg your pardon?
No, go ahead.
Yeah, and actually we had questionnaires and protocols which all patients had to fill in when they come into the hospital. And these protocols were actually important because we kind of like knew how to separate the patients. Okay, who is a suspect, who might be carrying the virus, and who is negative. We tested a lot of patients, and I think that's also an important thing that we had a lot of testing kits in the country. Every patient that came with, throat pain or diarrhea, which was a symptom that is not typical for COVID, but at the moment it's actually been proven it's typical for COVID-19, were actually also tested. So it's like really all the patients or patients with pneumonia, they got tested because it was important to separate this patient and to isolate them.
So when they come into the hospital, they get all of this tests done without necessarily reaching out to the Center for Disease Control?
Well, when they come into the hospital, they see the nurse first, and it starts at the door. The nurse starts asking them, okay, what symptoms do you have? And they fill in the protocol and have it in mind that the nurse is actually also protected and the doctor is also protected.
Okay, so in Nigeria, at the moment, we have over 800 health workers infected with the COVID-19, with the coronavirus. You heard our last respondent, I think you were following that conversation, when he talked about the inadequate training on how to wear the personal protective equipment, how to take them off, how to dispose of them. Now, if you hear that and you look at the response mechanism in the country compared to the response mechanism you had in Germany that you just talked about, how would you weigh the two and what could be done better here?
I can't really compare Nigeria to Germany because I think I'm in no position to compare it. I mean, I work in Germany, I don't work in Nigeria, but I would say at the moment, every country is trying to control this pandemic, and every country is doing its best with the resources it has. Because I cannot compare the resources Germany has and Nigeria. These are two different things, you know. But I think it should be handled, it should have been handled differently to stop the spread. And here, I mean, it started really early. The first cases were announced and we actually restructured the whole hospital, and not just our hospital, but many other hospitals were restructured. Staffs, cleaners, everyone got the training they needed. And I think I'm not quite sure if they do that in Nigeria. What's also important is everybody working in the hospital, every medical personnel has a protocol. Every day it's your duty. If you're on shift and if you're at work, if you have contact with patients that are COVID positive, you have to write the patient's name, what type of contact you had with that patient, and what you were wearing on. So basically, it's like every day when I close from work, I have to fill in this protocol. Who did I see today? Was he positive? Was he negative? And what did we, because it's important to follow the chain and know, okay, who was infected and who infected you.
All right, thank you very much. We've been speaking with Dr. Zainaba Adamu, who's a senior consultant in internal medicine. Thank you for joining us today on the program.
Thank you for having me. Have a good evening.
Now, the World Health Organization says there is little evidence, rather, that a change in the season will affect the spread of COVID-19. In the initial stages of the pandemic, some suggested that warmer climates or warmer weather might slow the spread of the virus, but this idea faded as the virus took hold during springtime in the Northern Hemisphere. Executive Director of the body's emergency program, Mike Ryan, says there is no date to suggest the virus will behave more aggressively or transmit more efficiently or not when the season change. This comes as scientists continue to look at the genetics of the coronavirus. And for more information on what's happening around the world and indeed around the situation of COVID-19, you check out the NCDC website. The Nigeria Center for Disease Control website has data for you as regards what's happening, the numbers of cases. Now, you see that as of yesterday, the number that came out was 663 new cases confirmed in Nigeria, bringing it up to over 13,000 cases in Nigeria. And while that's happening, you also see that some were also discharged. But beyond the Nigeria Center for Disease Control website, the World Health Organization website has the numbers as well, what's going on globally, how many cases there are, how many have been discharged, and how many have passed on. You go to these websites for details. You can also check out the Channels TV website for updates on our top stories, the COVID-19 situation in Nigeria and other stories around the world. That's channelstv.com. We'll give you updates on all of this. And that's it for this moment. Thank you for watching. I'm Neota Ibe.